Hey everyone, it's Dr. Nicole Rochester, founder and CEO of Your GPS Doc, and I am back with part 2 of observation status. If you missed part 1, be sure to scroll through and find it so that you can have the framework, the information that will make this second episode make a lot more sense, okay? So last time we talked about observation status versus inpatient status, and I left you all with a little bit of a cliffhanger. I left you with the statement that you need to care about this, you need to understand this because it will impact your bottom line, meaning the amount of money that you pay. So let's pick right up where we left off. It turns out that health insurance companies cover outpatient and inpatient services differently in most cases, and that goes for private insurance companies, Medicaid, and Medicare. So what happens is that your copay, which is the amount of money, that fixed amount of money that you pay for that visit, that is going to be different depending on whether you're an outpatient or an inpatient. So what happens is that in most cases, insurance companies contribute more money towards the bill if you are an inpatient. And they do that because, inpatient historically means you're sicker, you're in the hospital longer, and so they will take on more of the financial risk or responsibility, leaving you with a little bit less. But with outpatient, that is not the case. And so this is problematic because I shared with you in part 1 that you could be hospitalized as an outpatient for 2, 3, 4, 5 days. Can you imagine what that bill looks like after 5 days of getting IV fluids, IV medications, maybe oral medications, maybe x-rays and CAT scans? Can you imagine how those charges add up? And can you imagine how devastating it could be to receive a bill for a hospital stay where you thought that you were in one status and you find out after the fact that you were in a completely different status? So observation versus inpatient directly impacts your bill because your insurance company treats those two services very differently. The other thing you need to know and why you need to care about observation versus inpatient is that if you or a family member needs to go to a nursing home, what we call a skilled nursing facility. This is typically for rehab. Maybe there was surgery, or maybe the patient, is just really weak after being in the hospital for a few days and needs some additional physical therapy and things like that to help them get back on their feet. Well, guess what? Medicare will only cover the cost of that stay in a nursing home if the patient was hospitalized as an inpatient. And not only that, they have to have been hospitalized as an inpatient for at least 3 days or for at least 2 midnights, okay? So this is where it gets really, really tricky. And in my role as an independent health advocate, this is where I get the phone calls from families because they are desperate. They have had their loved one in the hospital for 3 or 4 days. Now the hospital is telling them that they need to go to a nursing home, only for them to find out that their loved one was not even admitted as an inpatient. They were admitted for that whole time or hospitalized as an outpatient in observation status. So this is why you need to understand these statuses. Now, contrary to what you may read or contrary to what you may be told, this admission status thing is very complicated and it is not the sole responsibility of the doctor. Yes, the doctor is the one who actually writes the order, but there are guidelines in place that dictate whether an insurance company feels like a patient warrants inpatient status versus observation status. So the reality is that even if your doctor, the doctor taking care of you or your loved one, has admitted you as an inpatient, the insurance company can and will go back and deny that stay if you or your family member did not meet the appropriate criteria. So I sometimes hear from clients or friends and family members, and they'll say, well, you just tell that doctor that you want to be an inpatient, or you just go tell that doctor that you want your mom to be admitted as an inpatient. You all, it's not that simple. There are very specific criteria, and it's way beyond the scope of Navigator Nuggets. But suffice it to say that, in my opinion, These criteria, as with everything else in our healthcare system, benefit the insurance company and not you and not your family members. So this is why it's so important that we are educated and that you know to ask the question when you or your loved one is being admitted to the hospital. If they're staying for, more than a night, ask, am I in observation status or am I an inpatient status? Now, if you or your family member has Medicare, there is a document called the MOON Notice, MOON. That stands for Medicare Outpatient Observation Notice. Because of the way that Medicare treats those hospital stays differently, now by law, you have to be notified if you are a Medicare patient that you are in observation status. Even with that notification, there's not a whole lot that you can do, but you at least need to ask the question so that you are aware. Now, if you have lots of things being done to you, if you are getting worse and not better, then you can certainly advocate for yourself or your family member if you feel that that status is not appropriate, or if you feel that you want the doctor to take another look at that, you can absolutely make that request. In fact, I encourage you to do so. But most importantly, you at least need to understand that no matter where you are physically located in the hospital, no matter how many days you are in the hospital, you may not be admitted as an inpatient, and that there are financial implications as a result of that admission status. So this is a great time to review your insurance policy, take a look at that small print that none of us like to look at, and find out how your insurance plan treats outpatient observation visits differently from inpatient so that you can be informed and that you can be prepared. All right, so thank you all for tuning in to this episode of Navigator Nuggets. I hope that this information has been helpful. As always, I ask that you like this video, share this video with individuals in your circle who can benefit from this information, and I'll see you next time. Take care.